Good evening and thank you for keeping it TV47. You are just in time for Body Garage with I, Sheila Chelangat. And of course, you know here is where your health matters. And in line with this year's World Glaucoma Week, this episode we are focusing on glaucoma, and taking us through it is Dr. George Ohito. How are you, Daktari?
I'm good. How are you?
I'm good. Could you introduce yourself to us?
Yes, as you've said, I'm George Ohito. I'm a senior ophthalmic clinical officer and a cataract surgeon at City Eye Hospital here in Nairobi. Yes.
We are talking about the world awareness for glaucoma. First, why is it important to raise awareness for this particular eye condition before even we get to what it is?
Let's consider the magnitude of blindness worldwide. Glaucoma is one of the major causes of blindness. It's estimated by the WHO that 76 million are blind because of glaucoma. And when we talk of 76 million, it's 76 million blind in both eyes. So it's huge. Secondly, glaucoma has been described as a silent thief of sight, meaning there are no symptoms. You become blind without knowing, no pain. And by the time you come to see us, significant damage has been done.
Okay. Yeah. So let's get to it. What is this eye condition called glaucoma? What causes it?
For the eye to function normally, there is some pressure within the eyeball that is within normal. When we measure, say, anything between 10 and 20 millimeters of mercury is normal. However, there are variations. When the pressure inside the eye goes too high, it damages particularly the optic nerve. That is the connection between the eye and the brain. And that damage is what we describe as glaucoma. Yes.
Okay, you're talking about the eye pressure. If you could just expound on it, what even causes it to become high? And what is the normal?
The normal is between 10 and 20 millimeters of mercury. The tissues of the eye work under certain pressure. This pressure is maintained by the production of fluid within the eye, which we call the aqueous fluid. Now, once produced, it has to be drained out of the eye. There are circumstances where the drainage channels are blocked. And when there is blockage of the drainage channels, the pressure will go high. Yes.
Okay. Now, you said that sometimes someone might not present the symptoms. So then how do I know that I could be getting glaucoma?
So we have to look at the risk factors.
Yes.
One of the main risk factors for glaucoma is age. As you grow older, the risk increases. Now, we have accepted that anybody above 40 should have their eyes checked periodically, possibly annually, because we may just as well catch glaucoma before you go blind. If you are an African, it's said that Africans, Asians, and Hispanics are more at risk of glaucoma than anybody else. If anybody in your family, a parent or a sibling, has glaucoma, you have an increased risk of developing glaucoma. If you've had injury to your eye, the risk is increased. If you have other medical conditions that are treated with steroids for long, then you are at risk of getting glaucoma. And to you, if you have a combination of all these, yes, then you need to have your eyes checked much earlier by your eye doctor or eye ophthalmic clinical officers or optometrists to rule out the possibility of you having glaucoma, because you may not know.
You've mentioned that if it is in the family, you are at risk, to mean that glaucoma is hereditary.
Most of it is hereditary. Some just occur. Yes.
Okay. And at what age does this condition begin for those who are at risk because of their age?
Let's say anybody is at risk of glaucoma. We just say there is increased risk as you grow older. Children are born with glaucoma, congenital glaucoma. Children develop glaucoma as they grow. We call them developmental causes of glaucoma, which are a variety. By the way, glaucoma is not a single disease. It's a group of diseases. But the presentation and the end game is the same. Loss of vision because of damage to the optic nerve.
So when you say you wouldn't normally present a symptom, you wouldn't know you're getting glaucoma, are there people who perhaps now, once it is at that stage that now it's glaucoma, they come in with some symptoms?
Yes. The main symptom usually is loss of peripheral vision. As I sit, I can see you and I can see the wall, quite a large area.
Yes.
Glaucoma gradually reduces your peripheral vision until you are only able to see what is in front of you, and that still gives you a normal vision, but you cannot walk past a table like this because you will not be seeing what is in the periphery. The most common glaucoma, we call it chronic open angle glaucoma. In the eye, we have the production of aqueous, which then is drained in an angle here. Yeah? And this angle, there are drainage channels. The drainage channels may be blocked, but the angle remains open. That is the commonest. We also have angle closure, where the iris flips forward and blocks the angle, and then the fluid cannot drain out of the eye. We call that closed angle glaucoma. So there are very many types and subtypes of glaucoma.
Let's get to the fluid. What is this fluid and what is its importance first in the eye?
Inside the eye, there are two bodies of fluids. In front of the lens here, we have the aqueous, which is very similar to other body fluids. But at the back, we have a large area of a gel, which you call the vitreous body. That's not very important. The aqueous fluid bathes the lens. The lens has no blood vessels, so it has no way of getting its nutrition and getting rid of the byproducts of metabolism. Likewise, the cornea in front only gets its nutrition from the aqueous. But once that nutrition is absorbed and the waste products are produced, they have to be gotten rid of through these channels as new aqueous is being formed by the ciliary body. Yes, so it's a continuous process. Yeah.
So if you clarify, this fluid is not tears.
It isn't tears. Yes.
All right.
Yeah.
You have mentioned what is the most common type of glaucoma in Kenya and cases, in terms of the cases you have seen as a doctor.
Chronic open angle glaucoma remains the most common and affects mostly people of advanced age, and for Africa, 40 years and above is advanced enough.
Now, you've said it ultimately leads to blindness. So does it mean it cannot be cured?
For patients, they want to hear the word cure.
Yes.
For glaucoma, we can only promise to delay blindness as long as possible. So if we can delay blindness for 30 years for a 50-year-old person, we will have achieved something. If we can delay it for 50 years, that would even be better. You will die seeing. The reason is once it starts, it's a progressive disease. If we catch it early, we can start you on medications. We have two end games. One is to reduce the production of aqueous so that the pressure does not rise. The other one is to encourage or improve drainage so that more of the fluid goes out. And occasionally we combine the two in severe cases. So anytime you have a disease that is not painful and you prescribe medicine, people forget to use their medicines.
Okay.
And that is the major cause of problems in glaucoma.
So every time someone has high eye pressure, it means that they're definitely a candidate of glaucoma.
Yes.
Okay.
There are variants. We may measure your pressure and find it high, but there is no damage in the eye. There are other things we will have to check. The thickness of your cornea. We have realized that if your cornea is thick, the pressure measurements may be higher, but we moderate that using some calculations to know whether you have glaucoma or not. If your cornea is very thin, the pressure may be read as low, yet you have damage. And when we do our calculations, we find you actually have glaucoma. So there are many measurements that we need to take care of.
Okay, and let's get to the congenital glaucoma for the children. For now, there is no cure as well, and will they grow up now to be blind?
You may be born with advanced glaucoma that simply there is no treatment. Now we have to deal with a child who is born and will live all their life blind. You may be born with some damage or no damage at all, but as soon as you are born, we recognize that there is danger. So what we do is try to treat medically and surgically to reduce your chances of going blind. We do succeed in quite a number of cases. Occasionally, the results are not as good because it also depends on what damage was done to the eye structures during the formation of the embryo. Sometimes the damage is that you cannot reverse.
Okay. Yeah. Before we get to how now you get to the diagnosis, I'm wondering, does it affect just one eye or is it both eyes? Can you have glaucoma in both eyes at the same time?
You would be lucky to have glaucoma in one eye, and it happens. Most of the time, glaucoma is a bilateral disease. Of course, in cases like trauma, then the risk is higher in the eye that was injured, but not the other eye. But when we talk of the general population, chronic open-angle glaucoma, congenital glaucoma, then we are talking of bilateral disease.
Bilateral. All right. Let's move to the diagnosis. What do you look at? Because you said sometimes you can even be confused for cataract. Some would be treated for cataracts instead of glaucoma. So before you make your diagnosis as a doctor, what do you look at?
Anytime a patient walks through our doors, number one in our mind is to search for signs of glaucoma. Because as I said in the beginning, it's a silent thief of sight.
Yes.
So you will not know that you have glaucoma. So even if you have come to change your glasses, we would like to peep through your eye to look at the health of the optic nerve. Because that is usually where the problem is. So we measure the pressure using our machines. Here we have what we call a slit lamp. It's just a microscope to magnify the tissues as we see them. But on the side here, we also have something we call a tonometer. A tonometer, this one will touch your eye briefly, and we record the pressures. So we check the pressure, and we also look at the back of your eye. This system is a clear system all the way
To the back.
to the back. So we look at your nerve after having measured the pressure.
Okay, Daktari.
That will tell us the situation.
All right.
Yes.
Thank you so much for taking us through that. We are up for our first commercial break. When we will be back, we will now learn what are some of the treatment options that are available for glaucoma. Do not go too far, but first take a look at the myths and facts of the day. Glaucoma can only affect older people. Glaucoma can affect people of all ages, although the risk increases with age. Glaucoma can be cured. There is currently no cure for glaucoma, but treatments can help manage the condition and slow its progress. All right, welcome back. This is Body Garage, and on this episode we are focusing on glaucoma, and taking us through it is Dr. George Ohito. Daktari, before the break, we were talking about the diagnosis, some of the diagnostic tests that you take during the diagnosis, and I'm wondering now, because this is a disease that typically one would not present symptoms, so then how would you determine the severity of the condition in a patient?
Yes, as I said before, we have to measure the pressure of the eye, look at the optic nerve. But in advanced cases, it is easy to pick out the disease. In early cases, there are subtle changes that we may not pick with the human eye.
Yes.
But once we have suspicion, we have an array of tests that we can do. We can scan the optic nerve to give us first a baseline,
Yes.
where we can do subsequent tests and compare. Secondly, because this is an objective method, we can see those changes. Number two, we do also have an analysis of the visual field. As I said, in a normal eye, when you open both eyes, you're supposed to see the extremes.
Yes.
But once you start losing the vision, it may be difficult to tell subjectively. So we have a visual field analyzer that helps us to map out your visual field, and that helps us to tell whether there is glaucoma, and sometimes glaucoma-like diseases, because we have some brain tumors, for example, which will present like glaucoma, and we are only able to pick them when we do this visual field analysis. We have also what we now call the optical coherence tomography, also scans the optic nerve and gives us a picture of what we are dealing with. So there is quite a number of tests that once we suspect glaucoma, we do to quantify the damage and also to plan for the treatment.
Now let's get to the treatment bit of it. What does it look like? What are the options that are available?
Glaucoma is where the normal production of the aqueous, there is not enough drainage out of the eye. So in early cases, we try to reduce the production of aqueous so that there is a balance, and that protects the eye. Sometimes we cannot reduce it enough. So we combine processes that reduce the aqueous production, but also increase the drainage. But what if the drainage channels are, blocked in such a way that there is hardly any drainage? Then we have to do surgery. And there are also a number of surgeries. We can do what we call a filtration surgery, where we open a channel for the aqueous to flow through. There are newer surgeries where we put a tube inside the eye to drain the aqueous out. And lately, we also have laser surgery that is used to improve the drainage, the filtration channels to work better. So each individual eye will be treated as an entity. The best would not be, the best in one eye would not be the best in another eye. So there are a combination of factors which will determine what is best for you and for a particular eye.
So if I'm getting you right, this eye might need eye drops, the other might need surgery.
Correct.
Ah, okay. Now let's get to now, living with glaucoma. How do you advise patients to live with it? Because say the eye drops, you're using them every day. Some might be painful. I might be, thinking to leave it for today, do it the next day. So how do you advise the patients to live with glaucoma?
You've raised a very important question, part of treatment. That what if the drops are painful? Yes. And some are painful. People react to drops, the components of it, or the preservative in the drop. And ours is to lessen the patient's pain, not to add to the pain. So there are various classes of medicines, and we can do a combination that is not painful to you. And if all of them are, you react to them, surgery is still an option. Yes. So we play around with all manner of medicines until we get the right formula. Okay,
Dr. And after now this treatment, how often would you advise a patient to come in for monitoring? And during this monitoring, what are you looking at?
Okay. Once a diagnosis of glaucoma has been made, it's a lifelong commitment to treatment and follow-up. We may use one type of medicine successfully for several years, yes, and then it starts to fail as more channels get blocked. So we need to combine, give a combination or totally change. So we cannot do this without monitoring. So initially we would like to see you, like in our case, every 3 months. And then as you gain control over the pressures, we may extend the period or reduce it if necessary. Patients do get tired of visiting the hospital. Of course, yes. It is tedious, it is costly, because most patients don't come from within the city. So we have to take cognizance of this in our management and discuss what is possible with the clients. We would also like to reduce the cost implications on travel, and when they are traveling, they are elderly, they need somebody else to keep them company. So yeah, this is tough, but it is something that we have to commit for a lifetime. Yeah.
You're saying it is a life commitment, but then also you said that ultimately it leads to blindness. So how do you manage now the patient's expectations?
Quite a number of times we succeed keeping you sighted for your life. A few times we fail for various reasons. Either the medicines did not work, availability is a big problem in the rural area. You may tell somebody you refill your prescription, then we see you in 6 months, but then they run out of medicine and they can't get it in the village, and they can't send somebody to the city. So they keep a long time without visiting the hospital. You may give them 3-4 bottles, and some parts of the country are quite hot, and these medicines may be denatured. Yes. So you are using them faithfully, but they are not useful. So many reasons, but we can promise to treat to the best of our abilities to delay blindness for as long as possible. Yeah.
Okay. And are there any lifestyle changes that I would need to probably look into, change, especially after treatment of glaucoma?
That is very important. I did forget to mention that diabetes and hypertension may also contribute to glaucoma. And even if they don't, they may worsen the situation.
You've mentioned that there's research ongoing for home test, but for a person already living with glaucoma, are there any home remedies that perhaps you would advise that they can use in managing this condition?
To the best of my knowledge, no. And sometimes people feel like because we practice modern medicine, we are averse to home remedies.
Yes.
Anything that can reduce the pressures will have to undergo a rigorous testing procedure to know the particular chemical or ingredients that actually causes reduction. And a lot of research will go into determining their safety profile, the dosage, and everything, and it becomes part of our formal treatment. Right now, I do not know of any home remedy that works. Somebody surprised me a few years ago that Bangi, cannabis sativa, is his drug of choice. I told him we need to monitor him, even if it is informally, to monitor his pressures over a long period of time. But he disappeared, so I cannot vouch for that treatment. Yeah.
Okay, we are talking about regular eye checks to manage this particular condition. What do I expect when I come in for such an eye check?
Any eye clinic in the country, unless they do not have the facilities or the infrastructure, the first thing is to test your vision and to measure your eye pressure. Once we have done that, no matter what brought you, we also look at the inside of your eye to look at the optic nerve, the state of the optic nerve. And that is the only way we can tell whether you are developing glaucoma or not. Yeah.
Okay, and how often should these eye checkups be done?
If you are normal, it's easy to remember an annual check. If you are normal, you could go to 2-3 years. But people do forget. So we try to make it simple. Have an annual eye check. Yeah.
Okay, and you've said that there's this risk of blindness. Are there some people who get to a point where they're now blind completely? And for them now, how do you advise them to now live with that, condition?
76 million of them are blind.
Courtesy of glaucoma.
Courtesy of glaucoma, worldwide. Once you're blind, it is irreversible. There is nothing you can do about it. Do you stop living because you're blind? No. There is this lady, Senator Crystal Asige.
Yes.
She's not let blindness hinder her from achieving her goals.
Yes.
So she's one of my best, I'm one of her audience. When she talks, I listen. And you really want to empathize with her condition, because had it been caught early, possibly there would have been a change. Yes. Was the treatment inadequate? We can't tell, because I've not handled her. But it happens. She's not the only one. Yeah.
Okay, Daktari. Thank you for that. We are up for a second commercial break. When we will be back, we will now see the some of the tests that are conducted when you come in presenting symptoms for glaucoma. Do not go too far. Keep it TV 47. Welcome back to this final part of Body Garage, where on this episode we are focusing on glaucoma. And just before the break, we have learned some of the treatment options available for glaucoma. And now our set has changed, Daktari. We do have our patient here. Could you take us through now this test that you probably look at when someone comes in to your desk?
Yeah, we call this a slit lamp, which is a microscope that examines the tissues in front of the eye. And occasionally we use some lenses to look at the inside of the eye. On the side here is an attachment that we call a tonometer. This is the gadget that we use to measure and estimate the intraocular pressure. Once the pressure is anything less than 20, we are okay, but we still have to look at the nerve to determine the health of the nerve. If the pressures are high, then we have to consider the prospects of starting treatment or close observation until we are sure there is damage because of eye pressures.
Okay.
Yeah.
All right. So let us see it now practically. What does he have to do?
So all you need to do is put your chin here and press your forehead on that band. We will use a bit of light, so sometimes the light dazzles, but I would ask you to look at my ears. So I'm going to examine your right eye first. So look at my left ear. And this light gives me an opportunity to examine the front of the eye.
Just the front of the eye?
Yes.
Okay.
The various parts. I can see clearly how your lid looks like, how the conjunctiva is, the health of the cornea, and any other tissues that may be present that need not be there.
Okay.
And we always examine both eyes. Yeah.
So right now he gets to see your right ear.
Yes. So just look at my right ear.
And Daktari,
Yes.
you said that sometimes with these machines you can see even to the back of the eye.
Yes.
So this particular machine can do that?
We can, only I did not carry the lenses that we use for that purpose, but we call it fundoscopy, examining the fundus of the eye, which is the back of the eye. And we have various methods. We can use this slit lamp. We can also use the machine that is just the gadget that's behind you to look at the inside of the eye. And that is the purpose of the whole examination.
Okay.
And we try to do this for everybody that walks through our clinics. As we said, glaucoma is a silent thief. There will be no pain, no symptoms. We catch it because we purpose to look for it.
Okay, Daktari.
Yeah.
So how do his eyes look like?
The eyes are basically healthy. He has some growths on the surface of the eye, on the part we call the conjunctiva. But these are benign growths that will not cause him any problems. This morning I've seen quite a number of them, and that's all that brought somebody to the hospital. We call them pinguecula. This need not worry you at all. Yeah.
What causes those growths?
There are growths that occur in some people. So it is said that exposure to UV light, but then all of us are exposed, but only a few have the risk to develop them.
So could those
You can rest.
those tissues go away, the growth? Does it go away with time?
They will be part of the features of his eyes.
All right.
Yes.
What are those tips you give some of your patients?
Live a healthy lifestyle. If you eat well, a balanced diet, then most conditions that bring us to the hospital will be taken care of. Unfortunately, you have no control for things like glaucoma. Theoretically, if you were to avoid UV light, then you also reduce your chances of getting cataracts. But we live in the tropics where the sun is there 12 hours a day. It's very difficult. But even if you do, you only reduce the risk, you don't eliminate it. So those are some of the things. People will use UV protection if you can afford them. It reduces the chance, doesn't eliminate it. So your a momentum for good, prolonged eyesight is to visit your doctor periodically.
Okay.
Especially if you are above 40. If you are younger than 40 and there is a family history of any eye disease, then you need to come even earlier.
And when I was growing up, Daktari, just on general eye health now, they said that taking carrots is good for the eyes. How true is that in the first place? And are there, foods that are good for the eye?
Yes. It is true to a point, but it is also misleading. Carrots, we know, are a good source of vitamin A. So are the green leafy vegetables, the sukuma wikis, the sagas, the spinach, and other foodstuffs, liver, eggs, red meat, will also give you enough vitamin A. Now, vitamin A is essential for the health of your skin, and the eye is derived mostly from the skin during embryological development. So yes, the health of your eye. If you are born short-sighted, you are born long-sighted, no matter how much vitamin A you take, it's not going to help you. But the health of your eye first, because if it is not healthy, then it's not going to see well. Yes.
Okay. For glaucoma, you said that sometimes you measure the thickness of the cornea. Is it something that we can see?
If you have thick corneas, this measurement, this machine will give us a higher pressure than normal. So we moderate it and we find your actual pressure. If you have a thin cornea, just a little dent, and then it will give us a very low reading. And if we moderate it with the formulas that we have, we will tell you your actual pressures. So you may go somewhere and they tell you your pressures are normal, but your corneal thickness is very thick. And over a period of time, we notice that you have damage, continuous damage. And when we check that, we find that we've been wrong all along. So it would be good to do all those tests. It's not available in many centers, but we are fortunate to have it, and so are many other centers within Nairobi. Yeah.
For people who are short-sighted or long-sighted, how would you advise for them to take care of their eyes even after, getting spectacles for their conditions?
Again, just a healthy diet to keep the eyes themselves healthy. But you have to use your glasses regularly to be able to see far. If you are short-sighted, they are lucky they can read from near comfortably.
Yes.
If you are long-sighted, reading becomes a problem. So you have to use your glasses consistently for reading and doing your other chores. But it is not going to reverse the condition.
It cannot be reversed.
There are some surgical procedures, newer laser type of surgeries that can reverse, that are available. For people who can afford it, they can go for it. We haven't started it here yet because we still have a lot of other eye conditions to grapple with. Our hands are full, but as we develop that may be an option in the future.
Daktari, if I could take you still on this matters eye health, why is it that for someone who is already on glasses, say someone is short-sighted, why is it that their lens keeps increasing? And how does spectacles now come in to, solve that condition?
Let me start with the amusing part of the whole situation. When somebody wears glasses for the first time and they see well, after some years, they lose their glasses and they claim their vision is worse than in the beginning. Yeah, sometimes it's true. Most of the times it is not. If somebody removes you from a disadvantaged environment, when you come back there, you start to see what you never saw before. So you think you are worse off. That's one. Secondly, for younger people, they're still growing. If you are short-sighted, if this was a normal eye, your eye is theoretically larger than normal. And as you grow, it becomes larger. So your short-sightedness increases. And that's why they have to change glasses periodically. Not really every year, but maybe every 2-3 years. The younger you are, the sooner you'll change your glasses. Okay. Some people will change it religiously every year. It's not necessary, but you need to come, you'll be rechecked. If the growth is faster than normal, then we have to check for other conditions. A common one being something we call keratoconus, where the front of your eye grows out of proportion, and that needs to be checked. The more reason why we need to have an annual check. So long as you have an eye condition, you need an annual check. If you are normal, you live your life, let's see you by the time you clock 40.
Okay. Yeah. What are the conditions of the eye that would need regular checkup?
The commonest is allergy. And allergy, almost a third of what we treat in the younger population is allergy related. Number one, because it makes you uncomfortable. Number two, the frequent rubbing of the eye may cause other problems. Number three, the commonest treatment for allergy is steroids. And once you use steroids for long, you could develop glaucoma or cataracts. And then your doctor needs to keep tabs on you that you do not treat the allergy and end up with an irreversible cause of blindness. Yes.
Okay. What does a healthy eye look like? Is it white? Is it red?
A healthy eye is never perfectly white. It has blood vessels, and these blood vessels make it appear. But there is an acceptable level of whiteness that we accept, and anything that causes the eye to be red raises an alarm. And there are things we have to look for because there are other conditions. Some are inflammatory, like conjunctivitis, uveitis. If you have a foreign body in the eye, it immediately becomes red, and that tells us where to look for. Yeah.
Okay. Perhaps your final thoughts on glaucoma and tips for living with it and for some to prevent it, even as we commemorate the World Glaucoma Week.
First, we need to recognize the fact that glaucoma has no symptoms. So let us take the step to have our eyes checked specifically for glaucoma. Two, if you have any relative who has had glaucoma, you need to go earlier. Three, glaucoma can be managed to reduce the rate of destruction of the optic nerve and reduce your path to blindness. Also, once you have glaucoma, we do not promise that you may not go blind. But what if you go blind? Life must continue. There are rehabilitation processes that can make you be as independent as possible. I've seen a shopkeeper who is blind. I've seen a farmer who is blind. My good friend Wanyoike used to be a marathon runner, blind. And we mentioned Crystal Asige. These are people, members of the society who have kept high-profile states despite the blindness. So don't sit back because you're blind. You can be rehabilitated to do even things that you never imagined you could do.
All right. Asante sana Daktari for taking us through this. It has been a pleasure. And for you back at home, I hope it is now your time to see that perhaps you need that regular eye check. You should consider it. Thank you for keeping it TV47 and Body Garage with Sheila Chelangat. Until next time, it is good night and goodbye.